Hello, everyone, and thank you for joining us today for the UCalgary webinar series on the roots of anxiety. My name is Kelly Johnston, and I'm a communicator here at the Cummings School of Medicine at the University of Calgary, and our expert today is Dr. Paul Arnold. Now, I'll say a little bit more about Paul in a couple of minutes, but first we're going to go over a couple of housekeeping notes. We have a lot of people joining us today. We're going to take questions throughout the webinar, but we may not be able to get to everyone's question, but we're going to do our best. You also might notice that Paul and I will be speaking to each other, but we spend a lot of time looking at our computer screens because that's where we see your questions and that's where we see our slides. The information presented is a summary of our scholars' research. You can submit questions throughout the webinar as well. We're going to try to leave a little bit of time at the end to take additional questions. And you can also keep the conversation today going on Twitter using the hashtag ExploreUCalgary. So our presenter today is Dr. Paul Arnold. He's a professor at the Cummings School of Medicine. He's the director of the Matheson Center for Mental Health Research and Education, and he's a member of the Hotchkiss Brain Institute. Now, Paul, a lot of your stuff involves anxiety disorders, child and adolescents, like that's where you focus most of your research, is that right?
Yeah, that's correct.
And you're a clinician as well as a researcher.
Yeah, so I'm a child and adolescent psychiatrist, so I work in children's hospitals.
Okay, great. And we want to ask you a couple of things about anxiety. We want to know who's in the audience today. Can you take a survey for us if you know someone who's suffering from anxiety, if you suffer from anxiety yourself? If you work in healthcare, we'd like to know if you're a student or researcher, or you're just interested in the topic. It kind of helps us direct a little bit about what we're going to talk about today. And what's your favorite part of your job? Because you have so many things that you do.
Well, yeah, and I was going to say, I think it's one of my favorite parts of my job is I have, in some ways, different jobs and different roles. So I really enjoy being able to both see patients and see kids. So after this talk, I'm going to go to our clinic and be able to actually help families and children and adolescents with anxiety one-on-one. So I like that direct patient care experience. But I also get the privilege of being able to do research and help other people with their research through my role as both a scientist and director of the Matheson Center.
Yeah, it's a very cool combination. We actually have quite a few clinician researchers, but I think too, it just keeps you really in touch with what's happening in the community, right?
Yeah, that's absolutely true. I mean, sometimes you get questions that you're in the room with a family or someone suffering from anxiety, for example, and it prompts a research question. And then your research also, I think, keeps you really on top of your game in terms of delivering evidence-based care. So it's a great combination. It's a real privilege.
So let's see who you are. We're going to check the results from our poll. So a lot of people know somebody suffering from anxiety, and probably that's not uncommon, hey?
Yeah, absolutely. We'll talk a bit about what we call the prevalence or how common anxiety disorders are, but these numbers really are not surprising.
Okay, and for those of you who are suffering from anxiety, thank you for letting us know, and we hope today's webinar helps you out.
Yeah, absolutely.
Okay, great. So why don't you walk us through a little bit about what we're going to hear today?
So we're going to talk about anxiety and just in a few ways. So I'm going to really start off just giving a bit of an overview of what are anxiety disorders. So a number of audience members mentioned that they suffer from anxiety. What does that mean? How do we, for example, me as a mental health professional, diagnose anxiety? Talk about that, a little bit about treatment. The second part of the presentation, we really talk about the roots of anxiety. So what are some of the genetic and environmental risk factors that predispose people to developing anxiety?
So is this that like nature-nurture thing?
Absolutely,
okay.
Yeah. And as you'll hear, and a bit of a spoiler alert, it's both.
Okay.
Nature and nurture. In fact, that's in many ways what prompts the last part of the presentation, which is, and I won't spoil the surprise about what orchids and dandelions are, but it's an image that really reflects how do genes and environment interact to confer risk to anxiety. So we'll talk about that as well towards the end of the presentation, and of course answer hopefully along the way some of the questions that the audience.
Yeah, and like we mentioned, we will try to answer it along the way, but also we'll leave some time at the end.
So, again, as I mentioned, to start off with, what is anxiety and when is it a concern? So I think it's really important to point out that anxiety is normal. So we all experience anxiety in our day-to-day lives, and in fact, it's having too little anxiety could be a problem. I mean, so we all know, for example, if you have a test the next day or something important you have to do at work, having a little bit of anxiety about it really kind of spurs you to do the work and preparation that you need to do. So it's a normal human response that alerts a person to something that needs to be done, sometimes to something that's even more serious, like a danger or a threat. And that's why we all have that. However, anxiety can become clinically significant, and that's typically, we think of that as when it's persistent, it's associated with distress, so it's highly distressing for the person, or it gets in the way of their daily lives, so it impairs them. And it's excessive for the context. So, I mentioned that kind of normal day-to-day anxiety. You've got a test the next day, but if you treat that test as if it is a real danger or threat, then it can be problematic. And we sort of think about anxiety in two ways. One is kind of thinking of it as being on a continuum, so that you can have anxiety traits. So we all have, more or less, we're all more or less anxious. If we did a poll or a questionnaire of everybody in the audience, we would find out that you all sort of range on a continuum about how anxious you are. So that's what we call anxiety traits. Anxiety can be more or less severe. When it crosses the line of being too severe, then it can become, as I mentioned earlier, clinically relevant. And typically people in that realm will meet the criteria for what we call an anxiety disorder. So those are kind of categories of anxiety that I'll talk about in a second that have specific features.
And maybe, like I know we said earlier that you're really an expert in the arena of anxiety with children, but this is for everybody. Like we're talking about all age groups today. Yeah. And I think too, is anxiety something that, you get at 5 years old and it carries through your life? Or could I just all of a sudden find myself with anxiety that I've never experienced?
Yeah, no, that's a great question. So typically, on average, it does start relatively early, at least that tendency towards anxiety, so that we think that about half of people are going to go on to develop anxiety disorders will have already developed them before their teenage years, actually. However, anxiety disorders, as mentioned, are extremely common, so it is certainly quite possible to develop an anxiety disorder for the first time later in life, at any time in life, actually.
Okay.
So it applies to all parts of the lifespan. And, I like to kind of, when I'm talking to people about anxiety, I like to use this image of anxiety disorders, again, are really that tip of the iceberg. That there's all of us have that anxiety. Sometimes it's submerged under the surface and we function our day-to-day lives. Sometimes it even helps us functioning. But when it crosses that line, it gets above water. It's the tip of the iceberg when we actually have a disorder.
Well, and it's interesting that you mentioned that tip of the iceberg, because we do have somebody who's asked, what's the difference between anxiety and depression? Like, would they know?
That's a good question. So, they do go together to some extent. So people with anxiety disorders, they're more likely to have depression, considerably more likely to have depression than a person who doesn't have an anxiety disorder. One way of thinking about it. Another way in which these two interrelate is that people who have anxiety disorders it can sometimes be the first sign of depression. So they first develop an anxiety disorder, and then they're at risk for developing depression later on in life. Okay. So you were talking about, the lifespan perspective. I see a lot of kids with anxiety. One of the things I look out for with kids is as they get older, do they start to develop signs of depression? So the question was, would we know? And yes, you can tell. So that there's sort of characteristic features. So, and we'll talk a bit in an upcoming slide about the symptoms of anxiety, but certainly depression has its own, even though they often go together, there are aspects of depression that are quite distinct. That kind of pervasive feeling of sadness. There's some signs and symptoms that go along with depression, like loss of sleep, appetite, things that aren't as characteristic of anxiety disorders. So anxiety disorders, historically have been put into three broad categories. So obsessive compulsive disorder, a lot of my clinical work is with obsessive compulsive disorder, and post-traumatic stress disorder have very distinct features. And actually mental health professionals have recently kind of put them in a sense in their own category of anxiety. Most of my talk I'm going to be referring to, unless sort of stated otherwise, to another broad group of disorders that we think of as being the kind of core anxiety disorders, and that for our kind of the way in which mental health professionals think, the kind of the diagnostic manuals that we use for, typically refer to these as the anxiety disorders. So there are things like social anxiety disorder, generalized anxiety disorder, separation anxiety disorder, panic disorder, and phobias. And they're really kind of specific types of anxiety. And we were talking about the overlap between anxiety and depression. These also overlap a lot with each other. So if you have one of these disorders, you're highly likely to have another.
It's interesting, like you put the post-traumatic stress disorder on here in that anxiety category. And I mean, I think that for myself, like I first learned about that in relation to soldiers, but I'm understanding that they're broadening that there's a lot of people that might have a PTSD issue that have never served in the military.
Yeah, that's a very good point. So historically, PTSD, post-traumatic stress disorder, was first recognized in combat veterans. If you look back at the records, you can see it all the way back to the early part of the century, and probably has happened for centuries, but first started getting recognized by doctors, in World War I, for example. But the category of PTSD was first officially assigned and around the time veterans in the U.S. were coming back from the Vietnam War. And however, since that time, we realized that, as you suggested, there's a lot of stressors that can lead to PTSD. And sometimes they're really something that just happens one time that's really severe. So a car accident, for example, could be a risk for PTSD. And sometimes there are things that are happening on an ongoing basis. So a child that experiences abuse over a period of time would be at increased risk for PTSD, for example.
Okay.
So, in terms of anxiety symptoms, they fall into a number of categories. So, and these kind of cut across these different disorders. But it's helpful to sometimes think about what does anxiety means, because it's kind of multifaceted. So there's the emotional state of anxiety that we usually think of when we talk about it. So feeling nervous, restless, or feeling tense. Some people talk about, and this is maybe particularly true for people who have panic attacks or panic disorder, just a sense of impending doom, something terrible is going to happen. There's the cognitive aspect of anxiety. It can affect your way of thinking and sometimes your ability to think clearly. So you can have trouble concentrating or difficulty controlling worries. And then there's a physiological aspect of anxiety. So people will find their heart feels like it's racing, or they're short of breath, or they're sweating. Again, we all kind of know these. I think we're kind of aware of these, but these are actually sort of core features of anxiety. And then finally, there's a behavioral aspect. And one of the things can be hugely problematic if people are anxious is they start to avoid things that make them anxious. It becomes a vicious cycle because they avoid them, they become even more anxious, and then they'll avoid them more, and so forth.
Before we get too far on those symptoms, can you have like all of these or one of these or a combination of these?
Yeah, it partly depends on the type of anxiety disorder that I mentioned. So, for example, with generalized anxiety disorder, they tend to have a bit of all of them. Panic disorder, as an example, is really one really core feature of it is that physiological response. That a panic attack, by definition, they'll feel their heart racing or shortness of breath. They'll get physical symptoms that go along with it. So you can have different combinations of them and still have anxiety.
Okay. We have a lot of people asking about treatment, and I just want to let everybody know, I think you're going to address treatment specifically.
Yes, that's right.
Coming up in the presentation?
Yeah, that's absolutely right.
So please keep those questions coming, but again, we'll address that specifically in a little bit.
Yeah. So we talked about, and we also got that sense from the poll from the audience, that anxiety disorders are really common. Even if you just think of anxiety disorder, so that's the group of people who either have seen a mental health professional, probably should, because their symptoms are significant enough that they're causing impairment or they're highly distressing to the individual. So surveys of the general population, general population studies have suggested that between 20 to 30% of people develop anxiety disorders in their lifetime. So that's
pretty high.
It's really high.
Mm-hmm.
You were asking earlier about age of onset, when things begin. So again, typically, on average, they begin early, but they can certainly happen later in life as well. There's an interesting figure that on average, although, again, men can certainly experience anxiety disorders as well, but it is something that is a little more prevalent in women. So it affects women about twice as often as men. It's important to point out that anxiety disorders, when they happen, they tend to persist over time. So they're not something that happens for a month or two. Typically, they last longer than that. And as suggested earlier, they can increase risks for other mental health disorders, particularly depression, as per that question that you asked.
Yeah, and with anxiety disorders, when you say like 20 to 30% over their lifetime, I know you said
Right.
that usually it starts early, but so could this be like an event that starts something? If it's, like later in your life, like maybe you didn't have or didn't think you had any problems as a child, but as you get older, you're noticing something.
Yeah, it could be. I mean, it could be that it could be that the anxiety disorder, and we'll talk a bit later about, there's genetic risk factors and there's environmental risk factors. It could be something changes in your environment that leads you to, to develop anxiety. Some people, for example, will find that they develop social anxiety disorder as they get into their teenage or young adult years, when it becomes more challenging to meet new people. They're kind of out of their comfort zone. They're not home with their families or their best friends that they grew up with. They'll start to develop that social anxiety. That's just one example.
Yeah.
But so there can be things that can happen during one's lifespan that can then trigger an anxiety disorder that wasn't there before.
Could it also be a work change? Like so many people are dealing with changes in their office place now, and maybe having to do duties they didn't used to have to, or half the people are gone, or that kind of thing.
Yeah, absolutely. Or a loss of a job can certainly be a trigger. That's, again, something kind of in the environment that's a marked change would certainly put somebody potentially at risk. And it's like a combination. So maybe one person might develop an anxiety disorder in response to the same stressor of a work, let's say a change in their work environment. Another person might not, and that could be because of a vulnerability that they always had a tendency to be anxious, but it never really became problematic for them until that change in their environment.
Okay, and what about how early? Like you say here, before age 11, how early could somebody develop or start showing signs of anxiety?
So it can, it can happen very early in life. So we can have a preschooler, for example, who has anxiety. It'll manifest itself a little bit differently depending on the time of life that it occurs. So there's one of the anxiety disorders I mentioned, something called separation anxiety disorder, and that's really something that we mostly see in kids because it's something that we think of in childhood that they're having to be separate from their parents, going to school for the first time or preschool. That'll become really problematic. Other kids are fine; they make that adjustment relatively quickly. But a child with separation anxiety disorder, they won't be able to do it, and they'll have to stay home, for example. One question that comes up a lot is, are more people becoming anxious?
Yeah,
because there
seems to be the disorder of the 2000s.
Yeah, that's true. And one. It's an interesting question. I mean, so what happens? What has happened is there've been a number of population surveys where people ask a questionnaire, again, like we could with this audience, for example, where they ask them a series of symptoms about, do you experience this, this, and this related to anxiety? And those studies have suggested there's a bit of an increase in people who feel anxious, experience anxious symptoms. However, when we there also we do notice that there's more people coming to get help for anxiety disorders, which of course could be just because people have become more aware of the fact that this could be a problem. This is something I can legitimately go see a doctor about. Whereas one time, as in many aspects of mental health, there was a certain stigma to doing that people wouldn't actually go seek help; they would just suffer in silence.
And is it something that can be treated and cured? Like, do people have anxiety forever, or is this something you can actually not have anymore?
So it is possible. So we kind of, the terms we use in mental health are kind of, remission or responding to treatment. So it is possible to have a remission. It does sometimes happen where a person goes for treatment for an anxiety disorder and they get better and it's possible it could come back later in life, but some people really do have one period of their life when they experience an anxiety disorder and it doesn't come back. That can happen. What is a little bit more common is people will they'll recover for a period of time, but they have a bit of a tendency. So that tendency persists over time, and they might get better they could get better for months or years, but at some point they may experience anxiety again, and then maybe they have to go back and get treatment. So there's quite a variation there. But one thing I wanted to point out, and before talking a bit about treatment, is that it's what is unclear, because again, there's this question about, are people becoming more anxious? We don't have good evidence that more people are actually developing clinical anxiety disorders. We think it's some combination of help seeking and more people reporting anxiety, but when it comes to the number of people who actually have diagnosable anxiety disorders, there's not really good evidence that that's actually increasing. So with regards to treatment, it's important to point out that there's really two types of treatment where there's a good evidence base, and sometimes they're used individually and sometimes in combination with one another. So there are medications that are effective for anxiety, and the one type of medication that has the greatest body of evidence that it works, it can be helpful in both adults and children, is what are called selective serotonin reuptake inhibitors. So it's a particular, and we'll talk a bit about serotonin when I talk a bit about the biology of anxiety later. It's a medication that acts on this particular brain chemical or the term we use is neurotransmitter called serotonin. But there's also some great therapy that can be also equally effective for anxiety. And in some individuals, that's all they need. They don't need the medication in many individuals. And the type of therapy that seems to work best, that's the strongest evidence, is something called cognitive behavioral therapy. And so it's a particular type of therapy that is quite structured in nature. So it's not just, and this can have its place too, but it's not you're just going to see a therapist and talking about your day. It's, there's a kind of a structure to it. Each session, the therapist will have kind of a plan that they come in with and talk to you about it, give you things you can do at home to help with your anxiety, things like that. So that can also be highly effective as well.
We hear all the time, like, live in the moment and, breathe and meditate and stuff like that. Is anxiety something that you can like fix yourself? Can you, be more aware and that kind of thing? Or is it something that you really should be going to a professional?
Yeah, it's a great question. I mean, I think it depends on, because we were talking about that continuum and that that iceberg image I showed earlier. I think if you're above the water, like if you're on the tip of the iceberg, I think it is beneficial to seek help from a professional. And there's a wide range of professionals that have expertise in mental health. In some cases, it could be the family doctor, who sees you and provides that care, that support that you need. Or it could be a range of mental health professionals who experience expertise in anxiety. If it's underneath the water where you're just feeling more anxious, there are a lot of approaches that can be helpful. One approach that often comes up a lot is, so there's an approach called mindfulness, and there is some evidence that can be helpful, again, particularly in managing that somewhat low-level anxiety, but sometimes combined with cognitive behavioral therapy. There's some good evidence for that, and that does involve things like you kind of alluded to, like just being able to manage your anxiety through exercises and things like that. That certainly can be helpful as well.
And what about the folks that say, if I just have a glass of wine in the evening, or now that, cannabis is legalized, is that a good treatment for anxiety?
Yeah, so the quick answer is no. So, I mean, a glass of wine in the evening, certainly can, is not likely to be harmful in any way. Likewise with, talking about cannabis, as a treatment for anxiety, which is sometimes, talked about and discussed, whether it be now that, cannabis is, legal in Canada, whether it be a self-medication or as a prescribed treatment, we don't have the evidence that it's effective. And, there is some interest in studying, cannabis or, cannabis derivatives as treatment for different mental health disorders. But at this stage, we don't have that evidence for its effectiveness in either anxiety disorders or actually in any other mental health disorder at this point in time.
Another question about treatment, is there any evidence-based research about sensory motor therapy for like a PTSD? There are different types of therapies that operate kind of on and I think the question may be referring to example for something called EMDR, which is eye movement desensitization reprocessing therapy, there's mixed evidence for those forms of therapy, I guess is the quick answer. So there are some studies suggest it may be helpful, some it's not as clear. Typically it's combined with elements at least of cognitive behavioral therapy when it's effective, or possibly with medication in some cases. So it's a good question. We may come back to some more treatment.
Yeah, absolutely. I'm
okay.
sure there's lots of questions in that regard. Just shifting gears a little bit about this question that came up around anxiety, is it nature or nurture? So we do know that there is a potential and potentially strong genetic contribution to anxiety. One of the ways that we know this is that we know that anxiety runs in families. So if you're anxious, more likely that your mom or dad either has a strong tendency to be anxious or maybe has an anxiety disorder. And some of the estimates are that 5 times increased risk in a close relative like that. We also know that there's some really interesting studies following the children of parents with anxiety disorders. We know that through those studies that if you look at the kids of parents with anxiety disorders, you can see an increased tendency quite early in life for them to have a bit of a difference in their temperament. There's even a particular type of temperament that's being really well studied called behavioral inhibition. So these are kids who, more likely than their peers, that they'll hang back. You know, that if there's a new situation or a new person, they're more likely to be a bit more reticent, not taking risks. And although many of those kids go on to do just fine and not have significant anxiety disorder, they're at somewhat increased risk of developing anxiety disorders as they get older. So there seems to be, again, this genetic risk and then this kind of some early signs, not yet of an anxiety disorder, but a tendency towards it that can, again, manifest itself as clinical anxiety.
But, it's interesting as you describe those signs, because when I hear that in my ear, I'm thinking, well, that just sounds like they're shy. So
Right,
how
yeah.
would I recognize the difference as a parent if my child is shy or my child is, maybe we need to think about anxiety?
And again, it kind of goes back to the sort of the earlier slide about, what makes an anxiety trait versus an anxiety disorder. So, shyness is a variant of normal. Like we all know that, and we can think about that in ourselves. Like some people have a tendency to be more or less shy, and in a social situation, and that's not necessarily a problem. Again, if it's not highly distressing for the person, if they adapt to the fact they're shy, or if it doesn't cause significant problems in their day-to-day life. However, there is kind of an extreme variant of shyness, sometimes thought of as an extreme variant of shyness called social anxiety disorder that I mentioned briefly earlier, where again, that's where it really does get in the way, so that that person really has a great deal of difficulty interacting with other people.
So could you give me an example, let's say, of that? Is that like, I'm not going to a birthday party, I don't feel like it, or is that, like, what does it look like?
So that might be, again, in a child, it might be that they never go to birthday parties or never any kind of event that might involve that might have other children. So they're kind of or they can't go up to other kids on the playground, and it actually causes them to basically not have the same kind of peer relations as their kids do. But it certainly can be even more extreme than that. They could become highly distressed and either freeze or cry. Again, with young kids. Social anxiety disorder is not just a child anxiety disorder, so it can, in adulthood, it would manifest itself a little bit differently. So the person who, won't take a job that involves a lot of interpersonal contact because they are so anxious in social situations, for example, that would be an example. Again, it's that fine line or threshold where it's now they're beyond shy because it's actually causing impairment for them. They're not able to function in their day-to-day life, and they're also highly distressed. So we don't want to pathologize normal shyness. I mean, there's absolutely, again, lots of people are shy, and that's just we're all different in how we behave and function in the world. But there are sort of things that can look like shyness, but will become much more extreme that we think of as anxiety disorder.
And also, like, seniors come to mind, because I've heard my friends sometimes talking about their parents who all of a sudden find themselves in different situations as they have to change homes or need additional care, and then all of a sudden they don't want to participate. Could anxiety be part of that? Like, can it develop for seniors?
Yeah, it can. So that's a good example of sometimes seniors can become more anxious, and it can actually again cross that line to being an anxiety disorder. And there are different challenges at each stage of life, and with seniors, some of what you're talking about can certainly interfere with their functioning and can trigger anxiety. Yeah. And again, it's all like just kind of finishing off the nature and nurture. It's important to point out that although these things run in families, this is not destiny, and the environment is really important too. So you can have a genetic risk, and still environment is really important. And we can actually tease that apart a little bit from what we call twin studies.
Okay, yeah.
So we compare identical twins, or basically really identical twins are almost, they have exactly the same genetic sequence. They're genetically identical to one another. And then we have, what we call fraternal twins, or we're just like any other brother and sister, but they happen to be born at the same time and grow up at the same time. They could even be different sex, boy, girl, for example. So they can be quite different. So we know from those twin studies that compare the fraternal and identical twins that we can tease out the degree of risk that's genetic, and we know from that if we can account for about 30% of the variation in whether one's more or less anxious based on genetic factors, and the rest is environmental factors. And a lot of that is not just about being in the same family, because that can confer a certain environmental risk if there's stresses in the family. In fact, most of it seems to be experiences that might actually differ between the twins, as they grow up, or any siblings as they grow up. So different environmental exposures that they have, et cetera. So that risk, it's also important to point out, because there was that question earlier about what's the overlap with depression. So we think that the risk for different anxiety disorders is shared amongst one another. And we also think that some of that genetic risk is similar to depression. So if you're genetically predisposed to develop anxiety, you may also be a little bit more likely to develop depression as well as you get older. So there's some shared genetic risk there. There are some early risk factors that can predict later onset of anxiety disorders. These apply a little bit more to childhood, but it could, some of them could potentially apply. We already talked about that behavioral inhibition temperamental style that can be a little bit of a marker. You're a little more likely to develop anxiety disorders. Parents having mental health disorders is an interesting risk factor because there's the genetic risk that we talked about. So you're genetically at risk, but sometimes that's hard to tease apart. If parents are, highly distressed by having an anxiety disorder, depression, for example, it also changes your environment. It's going to affect their parenting in one way or another. So there's, again, a bit of that combination of the two. And then just parenting stress. Again, if there's an environment in which there's a high level of parental stress, that can lead to somewhat increased risk of anxiety disorders down the road. I'm going to shift a bit to we talked about environmental risk factors and genetic risk factors. I'm going to touch a bit on some of the biology of that, the roots of anxiety, talk a bit about actual genes, their effective genetic variation on the brain and neurochemistry a little bit. And it's going to be a little bit of a quick overview, but maybe in the questions we can talk a bit more about it as well.
Sure.
So I'm going to focus, just for the sake, to keep things simple, I'm going to focus a little bit on some genetic and brain and neurochemistry studies that really focus on a particular protein called the serotonin transporter. And it's not to say that this particular aspect of biology explains everything or even most of anxiety, but there's been a lot of studies in it, so it's easy to explain in that regard. It's also really interesting. This is a particularly interesting protein because it's the one that is involved in drug response to the medications that are most commonly used in psychiatry and in anxiety disorders in particular. The SSRIs that I mentioned earlier. We know that there's some particular variants within this gene that are variable within the population. And I'm going to refer to these variations as long and short. So you can have these particular genetic variants. And again, if we were to take a survey of the audience here, we would find that there's quite a mix depending on your ethnic background. It's kind of, let's say roughly half are going to have one version versus another. And these have been associated with anxiety disorders, traits, and also other mental health disorders. So typically it's that short variant of this particular gene that seems to confer risk to anxiety and to somewhat to other mental health disorders like depression. And there have been some really interesting studies trying to link that to what's going on in the brain. So the example I'm putting up here is a type of study using what we call functional magnetic resonance imaging, or MRI. So MRI is a type of diagnostic imaging that's offered in hospitals for various things, including brain and mental health disorders. But in this case, in a research context, there have been these really interesting studies where they've shown people different types of faces showing different kinds of emotional expressions. So we can have faces that look really scared, or faces that look happy or neutral. And it seems that when we look at individuals who have this variance in this particular gene, their brains will respond differently to different types of faces. And in particular, they'll react strongly to faces showing fear. So they've got a bit of an excessive response in parts of the brain that we know are involved in anxiety, such as a brain region known as the amygdala. There is also some interesting studies looking at interaction between variants in this gene and environmental risks. So in this particular slide, we're looking at three groups of individuals. So those three
different lines,
yeah.
And we can see them colored there.
We can, yeah. They represent different genotypes or different genetic groups of individuals. And as we can see, if there's one line that you can kind of see is going kind of straight along the bottom, the LL, where people have two long variants. They can be exposed to an increasing number of stressful life events And their risk of, in this case, it's a bit of an extreme outcome. It's people who have had either attempted or have had thoughts about suicide, for which anxiety disorders confers a little bit of risk, depression even more so. So mental health disorders can confer risk for suicide, either thoughts or attempts. If this particular group of individuals, they can experience more stressful life events and their risk goes up a little bit, but it doesn't go up markedly. Whereas individuals who have the opposite, or they have two variants of this, what's thought to be kind of an anxiety or depression variant of the gene, their risk goes up quite high. Now,
Is this the red line?
Yeah, thank you. That's the red line with sort of diamond-shaped points.
Because that seems to go up dramatically.
That goes up dramatically. So on the bottom of the graph, you see the number of stressful life events, and this is based on questionnaires. This is a long-term study, by the way, following people over many years, done in New Zealand. You'll see that those stressful life events kind of increase the risk, but they mostly increase the risk in the context of this particular genetic variation. So it's an interaction. We were talking about nature and nurture. It's that nature being genes and nurture being environment, that surrounds you, and in this case, particularly stressful life events.
Right. So you're showing us the gene type that they have and how that relates, and that's in that SSS1 and 1 or whatever.
Yeah, exactly.
And then those life events. And when you say life events, are we talking about multiple years? Like, is this over decades, or is this like, you hear people like 3 terrible things happen in a row?
Yes.
Sometimes, right? In 1 month, 3 terrible things.
So it could be that, or it could be things that have happened over a more extended period of time. So again, this is a study that followed people over a number of decades. So it was really that kind of addition of like, they've not only had one bad thing happen to them, you were talking earlier, like they had a catastrophic loss of their job. They weren't expecting, they got fired.
Yeah.
That could be obviously a stressful life event, but this is that they had multiple things. They lost their job, they lost their partner, they got in a car accident kind of thing, just giving those as examples of stressful life events. So that cumulative load of stressful life events puts them at risk, but it seems to, again, interact with that genetic vulnerability. And again, this is one genetic variant, and so this isn't conclusive, but it's an illustration. There's a lot of interesting work looking at the interaction between nature and nurture, and the take home is that
it just shows the complexity, right? Yeah, a bit of both, but there isn't one that's stronger there to me.
Yeah, exactly. One thing that's come up that's even more interesting, and I kind of talked about in one of my opening slides about this image of orchids and dandelions. So one of the things that's come out in some of the genetic studies, including of this particular genetic variant that I talked about of the serotonin transporter, is there is some indication that the genetic risk can also be involved in resilience. So resilience is that idea that there's some people who are, even in the face of the most terrible things, kind of do okay. Like they don't seem to, in this, for the purpose of this talk, they don't develop anxiety disorders. They don't develop serious problems down the road, as opposed to those who are at risk, who seem to be more likely to develop those kinds of problems. And it's created there's this really interesting image that came from the work of you can see in the lower corner, some investigators, Boyce, Ellis, and Belsky are three of the main investigators in this area. And there's this concept of, there's some people who are genetic risk, they're orchids. So if you water them and they get the right soil, so they get the right kind of environment, and one of the particular genetic variant is that S allele I showed later. Yeah. They may actually do there's some stages they do even better than the average. So they're the individuals who might actually function even better. That they're relatively happy as they get older, or they function really well in their work environment. They have good relationships. But again, it's because they've had that just right combination of that. Yes, they've got a particular genetic variant, but they've had that really kind of perfect environment that's helped them grow. But if those same individuals had been in a different kind of environment, they'd grown up in an abusive home, or they had something terrible happen to them, some kind of traumatic event, they're also more likely to do poorly. So they sort of have both. They're just more responsive to the environment. The opposite is this L or long allele of this particular variant. They're sometimes referred to as dandelions, again, in literature, and you can plant them anywhere and they'll grow. And they don't necessarily do better than the average, but they'll do fine. Right. even in response to some pretty terrible things, potentially, they're a bit more resilient. And again, it is, full disclaimer, it's a little bit simplistic, but it's interesting, and I think, and there is certainly some increasingly a little bit of evidence to suggest that genes and environment aren't just influencing risk, but they're also influencing resilience, how well we do, not just how poorly we do.
And that's a good message to hear, right?
Absolutely, yeah. Yeah, again, it's that thing about, my parent, I'm worried, I'd be worried that the audience took away from this, oh, there's genetic risk, and my mom and dad both had anxiety disorders, and I went through a couple of hard things. That means I'm kind of, I'm destined to, but no, there's lots of other things that can happen. There's also good treatment for anxiety, of course. There's lots of other things that can happen that can lead people to be resilient. And I don't think for the sake of this talk I'll go into this in much detail, but I wanted to touch on that there's certainly some really interesting work, kind of drilling down a little bit more in the science behind this. So we've talked about how genes and environment interact, and the studies I've talked about are doing this in kind of a statistical way. They're looking at, you've got this genetic variant, and we've got some evidence that you've had a particular kind of environment, maybe a question around stressful life events, for example. But there's actually some interesting biology where the genetic kind of variants that I talked about, you're born with those. However, whether your genes get turned on or off at particular times of your life is influenced by other kinds of processes, and we call these epigenetics. So if that serotonin transporter gene, for example, is being expressed in a certain way, that's due to epigenetics, and epigenetic processes actually respond directly to the environment. Again, if there's questions about that, I'm happy to answer them, but I won't go into a lot of detail. But that's a really interesting area of research to kind of stay tuned for.
And that's that turning on or turning off.
Yeah, exactly.
You've got the gene. It doesn't mean you're going to get it, but at some point, something can turn it on.
Something can turn it on. It can express itself in a particular way based on the environment. What does this mean for some of this research that I've alluded to? And by the way, most of the research I've talked to, I and other researchers here at University of Calgary do research, and I'll talk about that in a minute, but isn't really my own research. But the research that we're doing and what other researchers are doing, what can it actually tell us, and how can it actually improve and help people who actually have anxiety disorders? One is we can start to identify biological pathways that can be targeted with particular kinds of treatment. Second is that there's a really interesting area of precision medicine, which is actually something that the Cummings School of Medicine here has invested in and is a priority for us. And that's understanding how individual differences in risk and resilience are influenced by things like genetics, epigenetics I talked about. And that, again, that sort of allows us to be able to target treatments better to the right person at the right time. So some of this research I'm talking about, we're hoping in the future that if you come to my office, or your child comes to my office with anxiety disorder, I'll have a bit of better sense of I have good treatments, but sometimes I don't know exactly which treatment will work for that child or that teenager.
We hear that sometimes, or, I've heard that talking to friends sometimes who talk about different treatments for anxiety and why one person does better on a drug than another person. And they'll say, well, that drug doesn't work for me. So is this part of that? That's
definitely part of that. So, so there is some types of genetic studies, including one that's going on here, that we're just starting on here, are to really target you can actually use genetic variances to understand if you're going to develop a side effect on a particular medication, such as the SSRIs that I mentioned, or if you're going to be a really good responder or a poor responder to that particular medication. And again, that'll just help improve treatment and help people get better and get better faster. So kind of the take-home messages are that, again, we talked about how common, and it was reflected in the poll from our audience, that anxiety is really common as a trait, but it's also even anxiety disorders. Anxiety disorders are common, and they certainly can be impairing. They can really get in the way of people's lives, and they begin early in life on average, but they can start any time in the lifespan. Anxiety is treatable, though. It's really important to point out that although they're common and impairing, there are good treatments out there.
And a few people are still asking, can it be cured?
Yeah.
As we talk about treatment.
So great question. So it's, there are individuals where the anxiety can be treated at one point in their life, and it never comes back to the same degree. It never gets in the way of their life again. There's absolutely people like that. Is it eliminated in the same way that taking out your appendix is that cures that problem? Mm-hmm. Not quite, probably not to that degree. So a person who has an anxiety disorder and gets really effective treatment, like I just mentioned, they probably are going to have a tendency towards developing an anxiety disorder later in their life. But if properly managed, it may never actually happen. They may just be able to manage their anxiety and do just fine, live a happy and life, and do just fine in terms of their work and lives and that sort of thing.
And just one more question on that regard, like if you went, if your physician recommends a drug treatment,
yeah,
does that mean you're always going to be on that drug? Because I know parents would hesitate, right? Especially in the kid stage or even at their own points in their life. It's like, you know what, I don't like to take drugs. So
yeah.
what would be your response to that?
Great question. So, and I get asked this a lot from families and patients who I see in the clinic as well. So quickly, the answer is no. You don't necessarily have to be on it your whole life. In fact, that's probably that is unusual. So it's not like if you have type 1 diabetes or the type of diabetes that requires insulin, you will have to be on insulin your whole life, and you just because that's how the biology of that disorder works. It's not like that. So typically, when we prescribe a medication, the psychiatrist prescribes a medication or a family doctor, the recommendation is that you be on that medication for significant period of time, because if you take one person off of it too quickly, even if they're doing a lot better, they may go back to having the anxiety disorder. So we would keep them on for a period of a year is the usual clinical guideline. And then at that time, we kind of look at what's going on. If their anxiety is a lot better, if they're at a fairly stable point in their life, that there's not a lot of new stresses that are happening, we would take them off that medication, often slowly and carefully, just to and see how they do. And in many cases, that works just fine, and they don't need to be on the medication again, or maybe they do, but it might be years before they need to be on the medication again. Yeah, so typically not lifelong for sure. And again, that last take home is what we talked a lot about, is that the roots of anxiety aren't just in your genes or just in the environment. It's an interaction between both, and that interaction is complex and something that's being better understood through research.
I think before you go on, Paul, let's take a few more questions.
Yeah.
Let's kind of rattle a few off here. We have a lot of people asking, like, is there like a test I can take to find out, like, do I have anxiety? And I know, like, there's a lot of disorders out there that is like, oh, take the 40-question depression test, if you have depression and stuff. So is there something like that for anxiety? Yeah,
so there are anxiety questionnaires, and some of them are used in research and are, can give you a bit of they can tell you, for example, if your level of anxiety is higher than the average, so how you compare it to people in the general population. However, there really isn't an anxiety test that you can do on your own that will identify whether you have an anxiety disorder. That really does need that kind of professional intervention, kind of a direct interview with somebody with some expertise in anxiety, because there's kind of criteria that they can go through that they can really only get from asking the questions directly.
And parents still are asking for a little bit more information on how do I know if my child has anxiety? Like if I'm, at those ages maybe where they're not responding to me, or I don't think they're being a typical either toddler or a typical teenager.
Yeah, I mean, each individual situation could be a little bit different, but as a general rule, I think what you're looking for is, are they really not functioning in the way they were before? So, as I mentioned, a lot like kids, like people of all ages, could be more or less anxious, but are they not getting to school? That can be, for example, one of the common things of red flags for anxiety disorders in kids is they refuse to go to school, and because of their anxiety. If you're seeing that, then that's a red flag that they could be anxious, or it could be a little more subtle. Maybe they go to school, but it's a lot of resistance to doing it. It seems to be associated with anxiety. So that's just so is it getting in the way of their life? In other words, a second area is the level of distress. So are they anxious, but they can kind of control it, and they can calm down with a little bit of reassurance or support, or is it overwhelming? They really seem highly distressed a lot of the time. So those kind of red flags, as a general rule, then you may want to seek help around that. But a little bit of anxiety, and the third thing too is, does it persist? So is it a bad day? They've got a test that they don't feel prepared for and they're anxious about. That happens one time. That's quite normal. But if it's happening persistently, again, that would be a concern and maybe reason to seek help from that.
And would there be outward signs like, nail biting or, chew? Like, would there be anything like that?
Yeah. So it's an interesting one. So possibly, I mean, so nail biting is kind of a habit that people can develop, and some people who bite their nails aren't necessarily anxious otherwise, but often they are, and it can be, certainly the two can go together. And if they seem tense, or if they complain of or seem to be, breathing rapidly, again, that's, so there's sort of physiological signs that I kind of alluded to earlier that can be associated with it. But typically it's more an expression of their thoughts and feelings. It's a bit more reliable, but they can also have some physical signs for sure, physical manifestations. Trouble sleeping, again, there could be other reasons for trouble sleeping, but one of them certainly could be difficulty with anxiety for sure.
And touching on the marijuana piece, you were saying like maybe not or no evidence-based yet that it's necessarily effective for treatment. But what about for bringing on anxiety in teenagers?
Yeah.
Like, is that something that happens?
Yeah, it's an interesting and currently a little bit unclear area in terms of kind of the opposite. We talked about its treatment, but can cannabis put people at risk for developing later mental health disorders? The best literature is on types of mental health disorders that we didn't, weren't really part of this conversation. So people who may develop particular kinds of really serious mental illnesses like schizophrenia or what we call psychotic disorders. There is some literature suggesting that cannabis can put a person at risk, and mostly in particular situations. So if they have a family history, or if they have, and another risk is that if they use it heavily and early, people are using it in their early teens and on a daily basis, for example. In terms of its risk for anxiety specifically, again, it's a little unclear. Some people might, for example, develop anxiety, particularly I talked about panic attacks. They can sometimes be induced by using cannabis, and probably some people more than others. It could be, again, because they have a family history and a bit more vulnerable that way. So I guess it's kind of with, obviously be cautious, and the big caution would be, again, especially younger people, again, are probably at more risk of developing any kind of mental health problems on cannabis compared to people who are over the legal age of using cannabis, for sure.
And if we fast forward a few years and there's that traumatic experience in your life, like, the loss of a loved one, bereavement, loss of work or something, is there, when do you know that you've developed anxiety due to this?
Right.
Do you know what I mean? Like, as opposed to I'm still sad, or I'm just, like, when do you go for help in these cases?
Yeah. No, it's a great question, because again, we talked about anxiety as a normative event, and having some anxiety or depression, other mental health types of symptoms after some catastrophic loss, like losing a loved one, is quite normal. And again, typically what we think of when it becomes pathological or becomes a problem, someone to seek help, is it lasting for a very long time? Is it interfering with one's functioning? Are you not gradually getting back to your day-to-day life after something like that? Are you highly distressed? Again, not in the short term, because that's normal. But are you experiencing?
Is there a timeline, Paul? Like when you say not in the short term?
Yeah, I mean, to be quite honest, it's a little bit arbitrary. I mean, so some of the guidelines suggest around, there's a normal bereavement period, but that differs. So it's hard to say, but certainly over periods of, if it's lasting months or a year rather than days or weeks, I think is kind of the thing. But again, if there's any doubt, certainly it's totally appropriate to seek a professional, because even if it is normal bereavement, getting some help, counseling can be helpful in that situation, or therapy can be helpful in that situation anyway.
Quite a few people are interested in the comment that you made earlier that it often affects women more than men. Is there any more evidence as to why? A couple of people are saying, is this a hormone thing?
Yeah, it's a great question. The quick answer is we don't know, and it may be a bit of both of biological. So, for example, hormonal factors being the most obvious difference between men and women, or is it some of it kind of there may be some psychosocial influences, cultural influences, that kind of thing. One question that's come up a lot in the past is it just women are more likely to go seek help because they're anxious, and there's been more stigma around men getting help around mental health? But the studies do seem to suggest that that it's not just that. So it's not about just help seeking. So hormonal factors may play a role, and one of the ways we know that is, for example, certainly people can experience increases in anxiety, sort of around menstrual cycle, or women who experience marked anxiety around the time of childbirth, those kinds of things. So they do suggest that hormonal factors play a significant role as well. So it's probably a combination of factors.
And knowing this, I mean, some people, we get so caught up on labels sometimes. I don't want to be the person labeled with anxiety. I don't want anybody to know and stuff like that. But, one person comments here that now they're thinking they've missed out on a lot because maybe they didn't seek help. So, what would you say to that? Like, should we be concerned about that? Like, if you feel this is a thing, just go get help.
I would say yes. I mean, if you think it's a thing, go get help. I think the labels, if they're used properly, should not be a problem. They can be helpful. The reason why we have labels anyway, as mental health professionals, is it kind of, if we can name it, we can look at the studies and the research and decide what treatment is appropriate. So, and again, for you as an individual, I think it kind of helps you know where to get help if you get a proper diagnosis. So I would encourage people to go get that diagnosis, not worrying about the risks of labeling, and just get the help they need.
Excellent. And let's talk a little bit about the research that's going on at the university.
Yeah. So again, we're doing a lot of research at the Matheson Center specifically, and the University of Calgary broadly. And these are really just examples. And I focus a little bit more on the research that relates to kind of a major topic, the roots of anxiety, early determinants of risk and resilience. So some of the research that I'm involved with, for example, is looking at genetic factors that link to childhood anxiety disorders. And I talked about a lot of the work I do in obsessive compulsive disorder. A colleague of mine, Dr. Daniel Capella-Sibley, is doing a long-term study of adolescents we talked about the genetic risk. So he's doing this really interesting study. He's just started looking at the kids of parents who have anxiety or depressive disorder. And we have other long-term outcome studies, like the ProCan study that Drs. Jean Addington and Dr. McQueen are involved in. And finally, we're doing a study where we're going into schools and administering mental health questionnaires to get a sense of mental health with kids, and doing an intervention that's really designed to reduce the stigma around mental health and help kids if they want to get help around mental health. So that's another area that we're looking at.
And like you say, this is just a sampling of some of the research going on here. And I think we do want to mention, too, that a lot of these studies are often recruiting participants, and that's something that you can get actively involved in. If you're interested yourself in this topic, participate, I think is our website. And we're going to send an email to everybody following this, and we'll put the link in there in case you're interested in
that would be great. Absolutely. Yeah, we always encourage people to get involved in research, and it's very helpful to learn more. And to help you ultimately. And got some recommended resources, which I know you'll be receiving as well. And these are great websites, I think, that can kind of provide, I put these up there because not only are they great resources themselves, but they provide links to other excellent resources as well. And one of them is Canadian specific, and the other one's a US-based organization that has great information. And then, finally, I'd just like to acknowledge a lot of, the work that we're doing is at the Matheson Center for Mental Health Research and Education. So we're University of Calgary, a base center. Then we're a partnership between the Hotchkiss Brain Institute and the Department of Psychiatry. And, again, just acknowledgements for all the support we've received from the community. We talked about people participating in research, but we've also been, the beneficiary of philanthropic support. So, for example, Ron Matheson giving to the Matheson Center and starting the Matheson Center. And I know that both our center and the HBI, Hotchkiss Brain Institute, have really relied on that kind of support. So we thank all of you for that.
And you do a lot of community outreach as well. I think, you guys got Science in the Cinema coming up. And so, it's a good idea to check the Matheson website out here at the University of Calgary and kind of see other things that you can get involved in or come to public talks. And
yeah, definitely.
And we're pretty much out of time. We have so many questions from so many of you, and we apologize that we weren't able to get to everyone's question, but we hope we've been able to answer some, give you some confidence, give you a few tips, and some resources that you can help yourself with. Now, you're going to get the slides in this recording in an email. There's also a survey. You've probably seen it on your screen throughout the webinar today. It'll come full screen in a moment. If you could just fill that out for us, that helps. You can also sign up for other webinars with us, download our ebooks, watch videos on the outcomes of our scholars' research here at the University of Calgary. And we also want to hear from you. We're always looking for topics. What are you interested in? So please let us know. Send us an email. And we actually have a webinar coming up that's going to deal with more anxiety, specifically schools. So I know we had a lot of parents listening today, a lot of people asking specific questions, a couple of educators that we weren't able to get to your questions. So that would be a good one to attend, is the November 21st. And I think that is Daniel.
Yeah, that's right, who I mentioned in terms of the research he's doing. Yeah, Dr. Daniel Capella-Sibley, I think, is one of the people doing that. So,
So I really want to thank you all for joining us. And Paul, thanks for sharing your expertise with us. This is fantastic.
Thank you for having me.
Some of the research. So we'll look forward to hearing how the results go with some of these studies.
Absolutely.
Thanks. Have a great day, everyone.